Welcome to the ASWB Clinical Social Work Licensing Exam Prep for the year 2026. Are you feeling nervous about taking your big social work test this year? I know the feeling, but we will get through this test together today. These questions come with full explanations, which will help you get your certification on the first try. Please leave your ideas in the comment section below, so I can improve this course. Section 1 focuses on human growth, behavior in the environment, and human diversity. You need to know how the human mind, body, and social skills develop. We will study infants, toddlers, young children, teenagers, adults, and also the elderly. Theories like those from Freud, Erikson, and Piaget are very important for you. Piaget talked about how children learn to think, reason, and understand the world. Erikson explained how we face social challenges at different stages of our lives. You must remember these stages, because the test will ask about them often. We also look at how family systems affect a single person over time. Families have rules, roles, and boundaries that change how members act and feel. If a family is healthy, they communicate well, share feelings, and support each other. When things go wrong, social workers step in, help out, and fix the problems. We also need to understand how society, culture, and money affect human behavior. People from different backgrounds face unique challenges, bias, and sometimes very unfair treatment. As a social worker, you must respect, value, and understand all these differences. We call this cultural competence, and it is a huge part of your job. You will see many test questions about working with diverse groups of people. Always choose the answer that shows respect, care, and a clear understanding of culture. Another big topic in this section is defense mechanisms and how people cope. People use denial, projection, and other tricks to hide their pain and fear. You need to spot these actions so you can help your clients heal. Addiction, trauma, and abuse also change how a person grows, thinks, and acts. Trauma at a young age can delay growth, cause fear, and create bad habits. We must be ready to talk about these tough topics with our clients. Grief and loss are also very common experiences that you will read about. People feel sad, angry, and confused when they lose someone they really love. You have to guide them, listen to them, and help them find peace. Remember to read each question slowly, carefully, and multiple times before you answer. Look for the keywords, because they will guide you to the correct choice. The test wants to see if you are safe, ethical, and ready to work. Never make choices that put your client, yourself, or the public in danger. Safety is the main goal, so always prioritize the well-being of everyone involved. We are going to review some specific questions to test your basic knowledge. These questions cover the key ideas, theories, and concepts you need to memorize. Read the explanations after every single answer, so you can learn the reasoning. Understanding why an answer is right is the secret to passing this exam. You must train, test, we need to fix, repeat, until you succeed today. Let us start with the first question. Take a deep breath, and begin. We will talk about classical conditioning, operant conditioning, and other ways people learn. Rewards and punishments can really change how a young child behaves at home. You should pay close attention to these learning models during your study time. Another main focus is how biological issues can easily change a person's mood. If someone is suddenly acting strange, always check their medical health first today. Medical problems must be ruled out before you look at mental health issues. When dealing with a crisis, you must act fast, stay calm, and listen. Your job is to lower their stress, keep them safe, and provide support. Always assess the person for suicide risk, harm to others, or severe abuse. We need to build a strong, trusting, and helpful bond with the client. Without trust, the client will not open up, share feelings, or seek help. Be patient, kind, and always maintain your professional boundaries during every single session. Point 1. What is the very first step when a client reports a sudden mood change? You must refer the client to a doctor for a full medical checkup. Medical problems can cause mood changes, so you need to rule them out first. Point 2. How does a social worker show true cultural competence during a therapy session? The worker must respect the client's beliefs, values, and traditions without any judgment. Understanding a person's background builds trust, helps communication, and creates a safe space. Point 3. Which stage of Erikson's theory involves a teenager trying to find their personal identity? The stage is called identity versus role confusion, and it happens during adolescence. Teens explore different roles, behaviors, and ideas to figure out who they really are. Point 4. What defense mechanism is used when a person blames someone else for their mistakes? The person is using projection, which shifts the blame to protect their own feelings. Projection helps a person hide their own guilt, shame, or fear from the world. 5. Why is it very important to identify signs of abuse in young children early? Early intervention stops further harm, protects the child, and allows healing to begin quickly. Abuse causes deep trauma, so you must report it, stop it, and offer support. Point 6. What is the best way to handle a client who is actively having a panic attack? You should remain very calm, speak softly, and guide them through deep breathing exercises. Calm actions help the client relax, lower their heart rate, and gain personal control. Point 7. According to Piaget, what does object permanence mean for a very young growing infant? It means the baby knows an object still exists even when they cannot see it. This is a major cognitive milestone, because it shows the brain is developing normally. Point 8. What should you do if a client talks about wanting to harm their own self? You must ask direct questions about their plans, means, and intent to stay safe. Safety is the main priority, so doing a full suicide assessment is required immediately. Point 9. How do boundaries help the relationship between a clinical social worker and a new client? Boundaries keep the relationship professional, safe, and focused entirely on the client's healing journey. Clear rules prevent confusion, stop inappropriate behavior, and protect both the worker and client. Point 10. What is the main goal of using a systems theory approach in clinical social work? The goal is to understand how family, friends, and society affect the individual person. A person is shaped by their environment, so we must examine all those connected parts. Point 11. If a client is angry at their boss but yells at their kids, what is this? This is called displacement, where a person shifts their anger to a safer, easier target. Displacement happens when expressing true feelings to the real source is too risky or hard. Point 12. What is the most common emotional response a person feels immediately after a major loss? Denial is usually the first reaction, because the brain tries to reject the painful reality. People struggle to accept sudden grief, so they temporarily pretend it did not happen. Point 13. How does operant conditioning explain the way a child learns a brand new good habit? The child learns to repeat the good habit because they receive a nice, positive reward. Rewarding a behavior makes it stronger, while ignoring it can make it slowly go away. Point 14. Why do social workers need to look at a person's strengths during a tough assessment? Strengths give the client hope, build their confidence, and provide tools to solve their problems. Focusing only on the bad things makes a person feel weak, sad, and very helpless. Point 15. What should a social worker do when a client refuses to talk during the first session? The worker should sit quietly, show patience, and let the client decide when to speak. Pushing someone to talk can ruin the trust, increase anxiety, and make them feel unsafe. 16. What is the main purpose of doing a biopsychosocial assessment on a brand new client? It helps you understand their body, mind, and social life to make a good plan. You need to see the whole picture, so you can offer the right kind of help. Point 17. If an older adult has sudden memory loss, what is the best first step to take? You must send them to a medical doctor to check for a urinary tract infection. Sudden confusion is often caused by medical problems, not dementia, so doctors must check first. 18. What does it mean when a social worker uses active listening with a sad client? It means you make eye contact, nod your head, and reflect back what they say. Active listening proves that you care, you are paying attention, and you understand their pain. 19. How do you respond to a client who suddenly starts crying during a difficult therapy session? You should remain quiet, offer them a tissue, and give them time to process emotions. Crying is a normal release of pain, so you must create a safe, supportive environment. Thank you for watching this first part of our social work exam review course today. I hope the questions and answers help you feel more confident, prepared, and ready now. Please check the description below to get the full course and all the helpful materials. Welcome back to part 2 of our ASWB clinical exam review course today. Today, we focus on assessing clients, making a diagnosis, and planning their treatment. You must learn how to gather information, understand symptoms, and create a plan. When a client first comes to you, you must listen to their story. We use the DSM-5 to figure out what mental health issue they have. The DSM-5 is a big book, which lists all the mental health disorders. You need to know the signs of depression, anxiety, and other common problems. For example, major depression means a person feels very sad for 2 weeks. They might lose interest in fun things, feel tired, or sleep too much. Anxiety disorders make people feel very worried, afraid, and nervous all the time. We have to ask the right questions, so can find the truth. An assessment helps us see the client's past, their family, and their health. Always check if the client has any medical problems, like we learned before. Medical issues can look like mental health problems, so doctors must check them. Once we know the problem, we must set clear goals with the client. Treatment goals must be specific, easy to measure, and realistic for the client. If a goal is too hard, the client will feel bad and quit. We work together with the client, because they are the experts on themselves. You are the guide, but the client must do the hard work themselves. Sometimes, we need to gather information from family members, teachers, or past doctors. We always need the client to sign a consent form before we ask. If a client is using drugs or alcohol, we must assess that too. Substance abuse can change how other mental health treatments work for the client. You must ask about their drug use openly, without judging them at all. Another big part of assessment is checking for suicide risk, abuse, and danger. You must keep your client safe, which is the most important rule today. If a client wants to hurt someone, you must warn the specific victim. This is called the duty to warn, and it protects the innocent public. We also look at a client's mental status, like how they speak today. A mental status exam checks their mood, their memory, and their thinking skills. If they see things that are not there, they are having a hallucination. If they believe false things very strongly, they are having a delusion now. These are signs of psychosis, which means they need serious medical help immediately. After the assessment, you write down a treatment plan, which guides your sessions. You must review this plan often, to see if the client is improving. If the client is not getting better, you must change your treatment plan. We want to use treatments that are proven by research to work well. Cognitive behavioral therapy is very popular, because it changes bad thoughts into good. We will learn about bipolar disorder, schizophrenia, and borderline personality disorder as well. Bipolar disorder involves extreme mood swings, from very high energy to deep sadness. Schizophrenia affects how a person thinks, making it hard to see real life. Personality disorders make it very difficult for people to keep healthy social relationships. Remember, diagnosing a client gives them a name for their pain and struggle. It helps insurance pay for therapy, and it guides your treatment steps properly. Always use simple language, so the client understands their diagnosis and their plan. Train, test, we need to fix, repeat, is still our motto for today. Now, let us look at 19 new questions to test your testing skills. These questions will help you pass your exam, so read them very carefully. Point 1. What is the most common time frame to diagnose major depressive disorder today? The client must have symptoms of sadness for at least 2 full weeks. The DSM-5 states that 2 weeks of depressed mood is needed for diagnosis. Point 2. How does bipolar 1 disorder differ from a regular major depressive disorder diagnosis? Bipolar 1 requires the client to have at least one clear manic episode. Mania involves high energy, less need for sleep, and very risky impulsive choices. Point 3. What must you do if a client refuses to answer an assessment question? You must respect their choice, gently move on, and try again later on. Pushing them will break their trust, so you must build a safe bond. 4. What is the main purpose of doing a mental status exam on clients? It helps you check their current thinking, their mood, and their physical behavior. This exam gives a quick snapshot of how their brain is working today. Point 5. Why do we need the client to help make their own treatment plan? Clients work much harder when they help choose their own personal healing goals. Shared planning gives them control, builds their confidence, and increases their overall success. Point 6. What should a social worker do if a specific treatment goal is not working? The social worker must talk with the client and adjust the plan together. Treatment plans must change as the client grows, struggles, or faces new problems. Point 7. What is a delusion when talking about a serious mental health disorder diagnosis? A delusion is a false belief that the client holds onto very strongly. Even when you show them obvious proof, they will still believe the lie. Point 8. How long must symptoms last to diagnose a client with generalized anxiety disorder? The client must worry excessively for at least 6 full months or more. 6 months proves it is a lasting problem, not just a brief stress. Point 9. What is the primary focus of cognitive behavioral therapy in a clinical session? It focuses on changing negative thoughts, which will change bad feelings and actions. By fixing how a person thinks, you can easily fix how they behave. Point 10. What does the term dual diagnosis mean in the clinical social work field? It means the client has a mental disorder and a substance abuse problem. Both of these problems must be treated at the exact same time together. Point 11. Why is collateral information from family members very helpful during an initial assessment? Family members can share important details that the client might forget or hide. This extra data gives you a much better picture of the real problem. Point 12. What is the very first step in making a solid clinical treatment plan? You must identify the main problem that is causing the client the pain. Finding the core issue helps you focus your energy on the right target. Point 13. How does a social worker figure out if a client has schizophrenia today? The client must show signs like strong delusions, hallucinations, or disorganized speech patterns. These severe mental symptoms must last for at least 6 months to diagnose. Point 14. What is the main difference between a hallucination and an illusion in therapy? A hallucination happens without a real object, but an illusion misinterprets real things. Seeing a ghost is a hallucination, while mistaking a tree for a monster is an illusion. Point 15. Why must a social worker clearly write down every single client assessment detail? Good records protect the client, guide the therapy, and prove your ethical work. If you do not write it down, the law says it never happened. 16. What is a key sign that a child has attention deficit hyperactivity disorder? The child will show a lasting pattern of poor focus and highly active behavior. These children struggle to sit still, wait their turn, or finish their homework. 17. How does post-traumatic stress disorder affect a person after a bad event? The person will have terrible nightmares, sudden flashbacks, and avoid any stressful triggers. Severe trauma changes the brain, keeping the person stuck in a state of fear. 18. What should you always do before asking a client's past doctor for records? You must ask your client to sign a legal release of information form. Sharing medical secrets without written permission breaks the law and ruins client trust. 19. How do you clearly assess if a client is ready to end therapy? You must check if they have met the main goals in their plan. When the goals are finally reached, the client is ready to live independently. Thank you for completing section 2 of our course, and doing so well. You can find the link to get the full course in the description below. Welcome to section 3 of our training, where we focus on clinical interventions and the process of helping. We need to know how to talk to clients, and what specific steps to take during therapy sessions. Social workers use different methods to help people change their lives for the better, every single day. One common method is the task-centered approach, where we focus on solving one problem at a time. We set small, easy goals, so the client feels a sense of success, and builds their confidence. Another important model is the crisis intervention model, which we use when someone is in big trouble. When a person faces a sudden disaster, they feel overwhelmed, and they cannot think clearly, or make plans. Your job is to stay calm, listen to them, and help them find safety and basic resources. We also talk about the stages of change, which helps us see if a client is ready. Some people are in the pre-contemplation stage, which means they do not think they have a problem. You cannot force someone to change if they are not ready to see the truth about their situation. In the contemplation stage, the person starts to think about changing, but they are still very unsure. The preparation stage is when they start making a plan to fix their life and move forward. Action is when they finally start doing the work, and maintenance is keeping those new, good habits. We also use group therapy to help people who are going through the same hard things together. Groups provide support, show people they are not alone, and allow them to learn from each other. Family therapy is also a big part of clinical work, especially when kids are struggling at home. We look at the family as a whole system, where one person's actions affect everyone else in the house. You might use techniques like reframing, where you help the family see a problem in a new way. Instead of seeing a child as bad, you see them as someone who is feeling very sad. Empowerment is a key word in social work, because we want clients to feel strong and capable. We do not do everything for them, but we give them the tools to help themselves and grow. Advocacy is also vital, because sometimes we must speak up for clients who have no loud voice. We fight for their rights, help them get services, and make sure they are treated with real dignity. During the middle phase of treatment, we deal with things like resistance, and also strong emotional reactions. Resistance happens when a client is afraid to change, so they miss meetings, or stop talking to you. You must address this openly, but kindly, to help them move past their inner fear, and keep working. Termination is the final stage of therapy, and it can be very emotional for the social worker. You must prepare the client for the end of your time together, weeks before the final session. We review what they learned, celebrate their growth, and talk about how they will handle future problems. If a client feels sad about leaving, that is normal, so you must let them share those feelings. Never end therapy suddenly, unless there is a very good reason, like safety, or a lost job. Always keep your talk professional, and do not share too much about your own personal life. This is called self-disclosure, and it can be helpful, but only if it truly helps the client. If you talk about yourself too much, the session becomes about you, which is not ethical or good. Train, test, we need to fix, repeat, is how we stay sharp and ready for this exam. Point 1. What is the main goal of the task-centered model in a therapy session? The goal is to help the client complete specific, small tasks to solve their problems. Breaking big problems into small tasks makes them feel easier and gives the client success. Point 2. How do you help a client who is in the pre-contemplation stage of change? You should provide information and help them see the negative results of their current actions. Since they do not think they have a problem, you must gently help them see the truth. Point 3. What does the term joining mean when you are starting family therapy sessions? It means the social worker builds a bond of trust with every member of the family. If one person feels left out, they will not cooperate, and the whole family therapy will fail. Point 4. What is the very first thing you do during a crisis intervention for a client? You must assess the client's immediate safety and their basic needs for food and shelter. You cannot do deep therapy if the person is in physical danger or has no home. Point 5. Why is the termination phase of therapy considered a very important part of the process? It helps the client maintain their progress and prepares them to handle life on their own. Ending well prevents the client from feeling abandoned and reinforces everything they learned during their sessions. Point 6. What should you do if a client starts acting very resistant during your therapy meetings? You should talk about the resistance openly and explore why the client feels so stuck. Ignoring the problem will stop the progress, so you must face the fear with the client. 7. How does a social worker use the technique of reframing to help a struggling client? You change the way a client looks at a situation to find a positive meaning. Reframing helps a client feel more hopeful and less like a total failure in their life. Point 8. What is the primary benefit of using a group therapy setting for people with trauma? It helps them realize they are not alone, which reduces their deep sense of shame. Hearing others share similar stories provides comfort and builds a supportive community for everyone involved. Point 9. What is advocacy in social work, and why is it so important for our clients? Advocacy is when the worker speaks or acts on behalf of a client to get resources. Some clients are too weak or scared to fight for themselves, so we help them out. Point 10. When is it okay for a social worker to use personal self-disclosure with a client? You can share personal things only if it clearly helps the client reach their goals. If the disclosure is for the worker's own benefit, it is unprofessional, and it is very unethical. Point 11. What does the term enmeshment mean in a family therapy system or a session? It means family members are too close, and they do not have any personal boundaries. In enmeshed families, one person's feelings become everyone's feelings, which causes a lot of stress. Point 12. How do you help a client move from the contemplation stage to the preparation stage? You help them weigh the pros and cons of changing, and look at their options. Helping them see the benefits of a better life motivates them to start making a plan. Point 13. What is the role of a social worker when acting as a broker for a client? The worker connects the client to needed services, like housing, food, or medical care clinics. A broker acts as a bridge between the client and the community resources they need. Point 14. Why must a social worker be very careful about the timing of the termination phase? Ending too early can cause the client to lose their progress and feel very abandoned. The client needs time to say goodbye and feel confident about their ability to move forward. Point 15. What is paradoxical intention in a clinical social work or a therapy session? It is when you tell a client to keep doing their bad habit to show them control. This is a complex tool used to help clients realize they can actually stop the behavior. Point 16. How does active listening help a client who is feeling very angry and unheard? It validates their feelings, which helps them calm down and start talking about the real issues. When someone feels understood, their anger often goes away, and they become much more open to help. Point 17. What is the focus of a solution-focused therapy session for a new client? It focuses on the client's future and the times when the problem was not happening. By looking at what works, the client can find their own path to a better life. Point 18. What should you do if a client asks you for a personal favor outside of therapy? You must kindly refuse the favor and explain the professional boundaries of your working relationship. Crossing boundaries ruins the therapeutic bond, and it can lead to very serious ethical problems. Point 19. Why is it important to celebrate a client's small successes during their weekly therapy meetings? Celebrating success builds the client's self-esteem and keeps them motivated to keep working hard. Change is difficult, so recognizing progress helps the client feel that their effort is worth it. Please remember to check the description below to get the full course and start your journey. I will see you in the next part of this course, where we learn more about ethics. Welcome to Section 4, where we look at the most important rules of our job, known as ethics. Ethics are the laws that tell us how to be good, honest, and helpful social workers. If you break these rules, you could lose your license, and you might even hurt your clients. The biggest rule is confidentiality, which means you must keep your client's secrets very safe. You cannot tell anyone what your client says, unless they give you written permission first. However, there are a few times when you must break this rule to keep people safe. If a client wants to hurt themselves, or someone else, you have to tell the right people. We also have to report any signs of child abuse, or elder abuse, to the government immediately. Another major rule is about boundaries, and keeping your professional life separate from your personal life. You should never have a romantic relationship with a client, even after the therapy is over. This is called a dual relationship, and it is very wrong, because it confuses the client. You are their therapist, not their friend, their lover, or their business partner in any way. You must also be honest about what you can and cannot do for a client today. If you do not have the right training for a problem, you must refer them elsewhere. It is unethical to treat someone if you do not know how to help them properly. We call this professional competence, and it means we always keep learning and growing our skills. Informed consent is another big topic that you will see on the clinical exam often. Before therapy starts, you must explain the costs, the risks, and the rules to your client. They have the right to know how therapy works before they agree to start the process. If a client is a minor, you usually need the parent to sign the consent form. Self-determination means that clients have the right to make their own choices in their life. Even if you disagree with their choice, you must respect their right to decide for themselves. Your job is to provide information, not to tell them exactly what they must do. The only exception is if their choice will cause them, or someone else, some serious harm. Social workers must also be aware of their own biases, and how they feel inside. If you have a strong personal feeling about a client, it is called countertransference. You must talk to your supervisor about these feelings, so they do not hurt your work. Transference is when the client puts their feelings about someone else onto you, the social worker. We must always put the needs of the client before our own needs, or our ego. This is the core O4 profession, and it is why we do this hard work. Conflict of interest is another rule, where you should not take gifts from your clients. Small gifts might be okay in some cultures, but you must be very, very careful. Usually, it is best to say no thank you, so the relationship stays clean and clear. Always document everything you do, because your notes are legal proof of your ethical work. If a situation feels wrong or confusing, always ask a supervisor for help right away. Train, test, we need to fix, repeat, and you will become a great, ethical social worker. Point 1. What is the very first thing you do if you suspect a child is being abused? You must call the Child Protective Services agency in your area to report it. Social workers are mandated reporters, which means the law requires us to report abuse immediately. Point 2. When can a social worker legally break a client's right to total privacy and confidentiality? You must break it when there is a serious threat of harm to self or others. Saving a life is more important than keeping a secret, so safety always comes first here. Point 3. What should you do if a client offers you a very expensive gift for your help? You should kindly refuse the gift, and explain that it is against your professional rules. Taking expensive gifts creates a conflict of interest, and it can change the therapy relationship. Point 4. What is informed consent, and when should a social worker give it to a client? It is an explanation of therapy rules, and it must be given at the start. Clients need to know the risks, costs, and benefits before they agree to any treatment plan. Point 5. What does the term self-determination mean for a client in a clinical therapy setting? It means the client has the right to make their own decisions about their life. Social workers guide clients, but we do not force them to make choices they dislike. Point 6. What is a dual relationship, and why is it considered very unethical in social work? It is when a worker has two different types of relationships with the same client. Being a therapist and a friend at the same time causes confusion and hurts the client. Point 7. What should you do if you feel a strong personal dislike for a new client? You must talk to your supervisor to understand your feelings, and stay very professional. Understanding your own reactions prevents you from treating the client unfairly during your therapy sessions. Point 8. Why is it wrong to provide therapy for a problem that you have no training in? It is unethical because you might give bad advice, and cause the client more harm. You must only practice within your areas of competence to keep your clients safe and healthy. Point 9. What does duty to warn mean for a social worker in a clinical setting today? It means you must tell a specific person if your client plans to hurt them. If a client names a victim, you must warn that person, and also the police. 10. How should a social worker handle their own personal social media accounts and client privacy? You should keep your accounts private, and never add clients as friends on the internet. Mixing your private life with your work life ruins boundaries, and it can lead to trouble. Point 11. What is the ethical way to handle a situation where you and a client meet in public? You should not say hello unless the client speaks to you first to protect them. If you speak first, people might ask how you know them, which breaks their privacy. Point 12. What should you do if you discover that a coworker is acting very unethically? You should talk to the coworker first, and then report it to a supervisor. Protecting the profession and the clients is more important than protecting a friend at work. Point 13. What is transference in a relationship between a social worker and their client? It is when a client projects feelings about someone else onto the social worker. A client might treat you like a mean parent, even if you are being very kind. Point 14. How does counter-transference differ from regular transference in a clinical social work session? Counter-transference is when the worker projects their own personal feelings onto the client today. This usually happens when a client reminds the worker of someone from their own past life. Point 15. Why must social workers be very careful about touching a client, like giving a hug? Touching can be misunderstood, and it might make some clients feel very unsafe or scared. It is best to keep physical distance to maintain a safe, professional, and ethical environment. Point 16. What is the best way to maintain professional competence throughout your long social work career? You should attend workshops, read new research, and always seek regular supervision for your work. The field of social work changes, so you must keep your skills updated to help clients. Point 17. What should you do if a client asks you for your home phone number or address? You must refuse, and explain that you only talk to clients during your office hours. Giving out personal contact info ruins your privacy, and it creates a very unsafe boundary. Point 18. What is the ethical rule regarding sexual relationships with former clients in the year 2026? Social workers should never have sexual relations with any former clients at any time. The power balance is always uneven, so a sexual relationship is considered harmful and very wrong. Point 19. Why is documentation so important when you are dealing with an ethical dilemma at work? Documentation provides a clear record of your thinking, your actions, and your professional reasoning. If you are ever questioned by a board, your notes will prove that you followed the rules. Thank you for completing this section on ethics, which is the heart of our work. You can find the full course in the description below, so you can keep studying today. I will see you in section 5, where we talk about diversity and social justice. Welcome back to section 5 of our course, where we talk about diversity, social justice, and systemic change. As a social worker, you must fight for fairness, and help people who are treated badly by society. Diversity is not just about race, but also about age, gender, religion, and physical ability too. We live in a big world, and every client has a unique story, based on their background. You must understand how power, privilege, and oppression affect the lives of your many clients today. Privilege means having an advantage because of who you are, or where you come from in life. Oppression is when a group of people is kept down, and treated unfairly by those in power. Social workers must recognize these patterns, and work to break them down for a better world. We use the term cultural humility, which means we are always open to learning from our clients. You do not have to know everything about every culture, but you must be very respectful. Ask your clients about their traditions, their beliefs, and how they want to be treated today. This builds a bridge of trust, and shows that you value them as a human being. Social justice means that everyone should have the same rights, and the same opportunities in life. We advocate for better laws, more resources, and an end to all forms of harmful discrimination. Sometimes this means working at the macro level, which involves changing whole systems or big laws. You might join a protest, write to a politician, or help organize a community group nearby. Institutional racism is a big problem, where whole systems are set up to hurt certain groups. This can happen in schools, in hospitals, and also in the very legal system we use. We must speak out against these unfair rules, even when it feels scary or very hard. Justice is a core value of social work, and it guides everything we do for our clients. Economic justice is also important, because poverty limits a person's choices and their health in life. If a person cannot buy food or pay rent, they cannot focus on their mental health. We help clients find jobs, get financial aid, and learn how to manage their money better. Helping someone escape poverty is a powerful way to improve their overall well-being and happiness. We also look at intersectionality, which means a person can belong to many different groups at once. A person might be a woman, an immigrant, and also a person with a physical disability. Each of these identities changes how she experiences the world and the challenges she faces today. You must look at the whole person and all the different layers of their unique identity. Gender identity and sexual orientation are also key parts of diversity that we must respect daily. Always use the name and the pronouns that your client asks you to use for them. This shows that you accept them and that you are a safe person to talk to. Discrimination against the LGBTQ+ community is still common, and we must stand against it always. Finally, we consider environmental justice, which means everyone deserves a clean and safe place to live. Poor communities often have more pollution, less green space, and fewer healthy food options for kids. We work to improve these conditions because a healthy environment leads to healthy people and families. Train, test, we need to fix, repeat, and let us change the world together starting today. Point 1. What is the main difference between cultural competence and the idea of cultural humility? Cultural humility means being open to learning from the client, instead of being an expert. It involves a lifelong commitment to self-reflection, and realizing we do not know everything about others. Point 2. How does institutional racism affect a client's access to good mental health care today? It creates barriers, like lack of insurance, or biased doctors, that keep people from help. Systems can be unfair, so we must work to change the rules to help everyone equally. Point 3. What should you do if you realize you have a personal bias against a client? You must acknowledge the bias, and work with a supervisor to ensure fair treatment always. Everyone has biases, but a professional social worker works hard to keep them out of therapy. Point 4. What is the concept of intersectionality in a clinical social work assessment of a client? It is the idea that multiple identities, like race and gender, overlap to create unique experiences. Understanding intersectionality helps you see the complex layers of oppression or privilege a client might face. Point 5. Why is advocacy at the macro level a requirement for all professional social workers? Because individual problems are often caused by unfair laws and broken systems in our society. Fixing a law can help thousands of people at once, which is a very powerful intervention. Point 6. What does white privilege mean in the context of social work and social justice? It is the unearned advantage that white people have in a society built on racial bias. Recognizing privilege helps social workers understand why some clients have an easier path than others. Point 7. How can a social worker help a client who is facing severe economic injustice? You can help them apply for benefits, find affordable housing, and learn new job skills. Solving basic needs like food and shelter is the first step toward any mental health growth. Point 8. What is the best way to support a client who identifies as transgender in therapy? You should use their chosen name and pronouns while providing a safe, non-judgmental space. Respecting a person's identity is the foundation of a good, helpful, and ethical therapeutic relationship. Point 9. Why is environmental justice a concern for social workers in low-income urban areas? Poor environments cause health problems, like asthma or lead poisoning, which hurt a person's life. Everyone deserves a safe home, so we fight for clean air, water, and safe neighborhoods. Point 10. What is ethnocentrism, and why is it harmful in a social work relationship? It is the belief that your own culture is better than all other cultures. This attitude makes the worker judge the client, which ruins the bond and stops all progress. Point 11. How does social stratification affect a person's ability to move up in society today? It ranks people in a hierarchy, which makes it very hard for those at the bottom. Being born into a lower rank often means having less money, education, and political power. Point 12. What should you do if a client's religious beliefs conflict with your personal values? You must put your values aside and respect the client's right to their own beliefs. The therapy session is about the client's journey, not yours, so you must remain professional. Point 13. What is the role of a social worker when dealing with a case of ageism? You should challenge stereotypes about older adults and advocate for their rights and their dignity. Older people are often ignored or treated like children, which is a form of unfair discrimination. Point 14. How can a community organizer help a neighborhood that is being treated very unfairly? They can bring people together to speak with one voice and demand changes from leaders. There is power in numbers, and collective action is a great way to achieve social justice. Point 15. What is cultural pluralism, and why is it a positive goal for our society? It is when many different groups live together, while keeping their own unique cultural identities. Instead of everyone being the same, we celebrate differences and learn from each other's diverse backgrounds. Point 16. Why is it important to understand the history of a client's community during an assessment? History explains current traumas and the deep distrust that some groups have for the system. If a group was hurt by the government in the past, they might be slow to trust you. Point 17. What is the main goal of restorative justice in the legal system for young offenders? The goal is to repair the harm and bring the victim and offender together to heal. It focuses on fixing the relationship and the community, rather than just using harsh punishment. Point 18. How do you handle a situation where a client's cultural practice seems very strange to you? You should ask the client to explain the meaning and the importance of that practice. Seeking understanding prevents judgment and helps you see the value in the client's cultural world. Point 19. Why must social workers be aware of global social justice issues in the year 2026? Because problems like climate change and migration affect people all over the entire world today. We are all connected, so fighting for justice elsewhere helps people everywhere, including our own clients. Great work on finishing Section 5 and learning about these vital social justice topics today. The link to the full course is in the description, so please check it out for more info. Next, we will finish with Section 6, which covers professional development and the final review. Welcome to Section 6, which is the final part of our training on professional values and LCSW exam review. We will talk about your role within an organization and how to keep growing as a clinical social worker. A big part of your job is working with other professionals, like doctors, nurses, and even the local police. We call this interdisciplinary collaboration, and it helps the client get the best, most complete care possible. You must be able to explain your social work perspective while listening to what other experts have to say. Sometimes, you might disagree with a doctor or a lawyer, but you must remain very calm and professional. The goal is always to help the client, so you must find a way to work together for their benefit. Supervision is another vital piece of your professional life, especially when you are just starting your career. A supervisor is like a coach, who helps you look at your cases and checks for any mistakes. You should meet with them regularly to talk about your feelings and any ethical problems you face daily. It is a safe place to learn, grow, and make sure you are doing the best work for your clients. Consultation is similar, but it is when you ask an expert for advice on a very specific, hard case. Burnout is a real danger in our field, because we work with people who are in a lot of pain. If you do not take care of yourself, you will become tired, sad, and you might even quit. Self-care is not a luxury, but it is a professional requirement, so you can keep helping others effectively. Make a time for hobbies, exercise, and spending time with friends, to keep your own mind healthy and strong. Professional development means that your education never truly ends, even after you get your license this year. You must stay updated on new research, new laws, and new ways to treat mental health disorders today. The ASWB exam tests your ability to think like a social worker, and make safe, ethical, and sound decisions. Always read the questions to see if they are asking for the first step, or the most important action. Keywords like first, next, best, and most change how you should choose your answer on the test. If the question asks for the first step, look for an assessment or a safety check as your answer. If it asks for the best action, look for the choice that follows the most ethical social work rules. Pace yourself during the exam, and do not spend too much time on one single, confusing question today. If you get stuck, pick the best choice you can find, and move on to the next question immediately. You can always come back to it later, if you have extra time at the end of the test. Stay positive, believe in yourself, and remember all the hard work you have done to get here today. You are going to be a wonderful social worker, and you are going to change many lives for the better. Train, test, we need to fix, repeat, and now you are finally ready to pass your licensing exam. Let us look at the final 19 questions to finish our course and get you ready for success. Read each one carefully, think about the rules, and then check the explanation to see the real logic. Point 1. What is the main purpose of seeking regular supervision as a clinical social worker today? Supervision helps you grow your skills, stay ethical, and handle the stress of your hard job. A supervisor provides guidance, catches your mistakes, and supports your emotional health during difficult cases. 2. How should you handle a disagreement with a doctor during a team meeting about a client? You should speak up professionally, explain the social work view, and focus on the client's needs. Collaboration requires open communication, even when experts disagree on the best path for a client's care. Point 3. What is vicarious trauma, and why should social workers be aware of it during their work? It is when a worker feels the pain of a client's trauma as if it were their own. Hearing about terrible events all day can hurt your mind, so you must use self-care to stay healthy. Point 4. When should a social worker seek a consultation from an outside expert on a case? You should seek consultation when a case is too complex, or outside of your usual training area. Asking for help ensures the client gets the right treatment, and it protects you from making big mistakes. Point 5. What does the term burnout look like for a social worker who is working too hard? It looks like feeling very tired, having no energy, and losing your care or empathy for clients. Burnout happens when stress is too high for too long, so taking breaks is very important for you. Point 6. Why is it important to follow the chain of command within your social work organization? Following the chain ensures that information flows correctly, and that the right leaders make the big decisions. Respecting the hierarchy prevents confusion, and keeps the organization running smoothly and safely for all the staff. Point 7. What is the social work perspective that you bring to a team of different professionals? Our perspective looks at the whole person, their environment, and the social systems that affect them daily. While a doctor looks at the body, we look at family, money, and community to help the client heal. Point 8. How can you avoid making mistakes when you are feeling very overwhelmed by a high caseload? You should stay organized, prioritize your tasks, and talk to your supervisor about your high stress levels. Being honest about your limits protects your clients from poor service, and protects you from making errors. Point 9. What should you do if you realize you made a clinical mistake with a client's case? You must tell your supervisor immediately, and work together to fix the problem as fast as possible. Honesty is an ethical rule, and hiding a mistake can lead to much bigger problems for the client. Point 10. What is the most important thing to remember when reading an ASWB exam question today? You must look for keywords like first, next, or best to understand what the question wants. The exam tests your ability to follow the correct order of steps in a clinical social work situation. Point 11. Why is self-care considered an ethical responsibility for all professional social workers? Because if you do not take care of yourself, you cannot provide safe or effective help to others. An unhealthy worker can make bad choices, so staying well is part of being a good professional. Point 12. How does continuing education help you maintain your social work license over many years? It keeps your knowledge fresh, teaches you new skills, and ensures you follow the newest laws today. The field is always changing, so you must keep learning to provide the most modern and effective care. 13. What should you do if your supervisor gives you advice that seems very unethical or wrong? You should discuss your concerns with the supervisor, and then go higher up if they do not listen. Your first duty is to the ethics of the profession, even if it means disagreeing with your boss. Point 14. How do you prepare for the termination of a supervisory relationship when you change jobs? You should review your growth, say goodbye properly, and ensure all your client files are completely finished. Ending a professional relationship well is a skill that you should practice for your own career growth. Point 15. What is the role of a social worker when acting as a mediator between two parties? The worker stays neutral, and helps both sides find a fair solution to their big problem together. A mediator does not take sides, but instead facilitates a healthy conversation to reach a peaceful agreement. Point 16. Why is it important to understand the culture of the organization where you work today? Understanding the culture helps you navigate the rules, build relationships, and get things done for your clients. Every office has its own way of doing things, so learning the unspoken rules helps you succeed. Point 17. What should you do during the exam if you feel yourself becoming very anxious or panicky? You should stop for a moment, take a few deep breaths, and remind yourself that you are prepared. Managing your stress during the test is just as important as knowing the clinical facts and the theories. Point 18. What is the best way to handle a client who tries to contact you through your personal email? You should move the conversation to your work email, and remind them of your professional communication boundaries. Keeping work and life separate protects your privacy, and maintains the professional nature of your therapy relationship. Point 19. Why should you always use professional language when writing your clinical notes for a case? Because your notes are legal documents that can be read by judges, lawyers, and even the clients themselves. Professional writing shows that you are competent, objective, and that you take your social work job seriously. You have now completed the entire course for the ASWB Clinical Social Work Licensing exam. I am so proud of the work you have done, and I know you are ready to pass. Remember to train, test, we need to fix, repeat, as you do your final study sessions. Please get the full course in the description below, to have all this information in one place. Good luck on your exam, and I look forward to hearing about your success in the comments.